Hi everyone, it's Kalonda Henry here from Broad Horizon Speech Therapy, coming to share 3 important differences between school-based speech-language therapy and private therapy. So I would like to spend today highlighting 3 of those important factors that I find important for parents to know the differences between school-based therapy and private therapy, and really talk about those just briefly in order to create an understanding. So the first major difference between speech therapy received in the school system versus private therapy are the criteria for qualifications. So in the school system, the Department of Education sets forth guidelines that must be met in order for a student to receive speech and/or language services. So it's a series of events that must occur and certain things that must happen, testing that's completed, and then also scoring within certain ranges that must be met in order for a student to receive those services through the school system. And that's important because also there must be some type of academic relevance in order to show that the student's academic performance is affected as a result of the speech and/or language impairment. In comparison, when you look at private therapy, speech and language pathologists who practice in private therapy are not held to the Department of Education guidelines in terms of looking at certain test scores and qualifying based upon academic performance. So there's a lot more flexibility in terms of the assessments that the speech and language pathologist can complete, and looking at those outside of academic performance, but more on a functional level for a speech and language pathologist working in private therapy. So those are really key factors, is that in the school system, you must qualify for services, whereas in private therapy, there are really no set guidelines for what qualifies a student per se for receiving services outside of the speech and language pathologist's recommendations and scope of practice of speech and language deficits. The second important difference is parent involvement. So in the school system, the parents are usually not meeting with the speech and language pathologist, except for when things like an individual education plan are set, when the child is initially staffed into the program. Maybe they're meeting for a conference, things like that. In comparison to private therapy, you usually see the therapist every day because you're bringing your child to therapy. They're also talking to you directly about things that you can try at home in order to help bridge the gap with those speech and language deficits, and talking about their progress. So there is a lot more parent involvement and connection between the therapy sessions and private therapy, because even oftentimes, I know myself, I've had parents join in on a therapy session and really let them learn hands-on during the session what it is that I'm doing and how they can facilitate that at home. Versus when working in the school system, it's sometimes difficult to show hands-on methods to parents because I'm simply speaking to them on the phone, and it's in a short amount of time, or I'm sending paperwork home, and sometimes those important things get missed. So that's another major difference between the two. The last and final difference between school-based speech and language therapy and private therapy is the obvious: monetary. So school-based speech and language therapy services are free. That is a service that is provided through the Department of Education, and therefore that's why there are certain guidelines and criteria that must be met in order for the student to receive those services. Now with private therapy, that is at a cost to the parents or the caregivers that are deciding to put their child in therapy, and that may be through their out-of-pocket expenses or through some health insurance plans, and those things are different. So that is the reason why there are guidelines set forth for the services, and in addition to those guidelines being set in a monetary value, When you are paying for private therapy services, your child is being seen one-on-one. You're interacting directly with the therapist. The therapist is directly interacting with your child. You're able to have flexibility around scheduling, and then you're also able to very carefully look at the time limits that your child works well in, and those types of things. However, in the school system, the flexibility with time is different. Obviously, the child must receive speech and language therapy services during school hours. So there is limited flexibility on that. And usually the times are set forth, decided upon the speech language pathologist schedule, as well as the school schedule for certain activities that occur during the day, and important things that your child needs to be present for throughout the academic day. So those are really key top contenders of differences for speech and language therapy in the school system versus private therapy. I really do get that question a lot, and I wanted to just highlight briefly on some major differences in order to help parents understand a little bit more about the process in which maybe their child receives outside therapy and they're wondering about receiving school therapy. And it seems like an easy fix because your child has already been diagnosed with the speech impaired program, so they should be receiving services at school. However, there is a process, and under that process, although your child has received outside private therapy, there must be regulations followed and guidelines met to receive services in the school system. So if you have any more questions, I'd love to highlight some more things that I feel are important for you all to know. And I hope you found this information very valuable. And please share and like our page and be on the lookout for more content.